Good afternoon. My name is Priyanka Venkatraman, a BSc Biotech student from Oxford College of Science. This video is to create awareness about hepatitis. I'm going to talk about transmission of hepatitis. There are 5 types of hepatitis: hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E virus. Hepatitis A virus is present in the feces of infected person and is most often transmitted through consumption of contaminated water or food. Certain sex particles can also spread HIV. Infections are in many cases mild, with most people making a full recovery and remaining immune from further HIV infections. However, HIV infections can also be severe and life-threatening. Most of the people in the area of the world with poor sanitation have been infected with this virus. Hepatitis B virus, that is HBV, is transmitted through exposure to infected blood, semen, and other blood fluids. HBV can be transmitted from infected mothers to infants at the time of birth or from family member to infant in early childhood. Transmission may also occur through transfusion of HBV contaminated blood and blood products, contaminated injection during medical procedures, and through injection drug use. HBV also possess a risk to healthcare workers who sustain accidental needle stick injuries while caring for infected HBV patients. Hepatitis C virus, that is HCV, is mostly transmitted through exposure to infected blood. This may happen through transfusions of HCV contaminated blood and blood products, contaminated injection during medical procedures, and through injection drug use. Sexual transmission is also possible but is much less common. There is no vaccine for HCV. Hepatitis D virus, that is HDV infection, occur only in those who are infected with HBV. This dual infection of HDV and HBV can result in a more serious disease and worse outcome. Hepatitis B vaccines provide protection from hepatitis D virus infection. Hepatitis E virus, that is HEV, is mostly transmitted through consumption of contaminated water or food. HEV is a common cause of hepatitis outbreaks in developing parts of the world and is increasingly recognized as an important cause of disease in developed countries. Thank you.
Hello, I, Trishya Rangaraj from BSc Biotechnology, the Oxford College of Science. I would talk about the signs and symptoms of hepatitis. Hepatitis has a broad spectrum of presentation that range from a complete lack of symptoms to severe liver failure. The acute form of hepatitis, generally caused by a viral infection, is characterized by a constitutional symptoms, while the chronic hepatitis presents similarly but clear signs and symptoms of specific liver dysfunction with long-standing inflammation and damage to the organs. Acute viral hepatitis follows 3 distinct phases. The initial prodromal phase involves non-specific and flu-like symptoms common to many acute viral infections. These include fatigue, nausea, vomiting, poor appetite, joint pain, and headaches. Fever, when present, is most common in the cases of hepatitis A and E. Yellowing of the skin and whites of the eye follow the prodrome after about 1 to 2 weeks and can last up to 4 weeks. The non-specific symptoms seen in the prodromal typically resolves by time, but patients will develop an enlarged liver and upper abdominal pain. The recovery phase is characterized by the resolution of clinically symptoms of hepatitis, which is persistent elevation in the liver lab values and potentially a persistent enlarged liver. When hepatitis is continued for more than 6 months, it is termed as chronic hepatitis. Chronic hepatitis is often asymptomatic early in its course and it is detected only by a liver laboratory studies for screening purposes. As the inflammation progresses, patients can develop constitutional symptoms similar to acute hepatitis, including fatigue, nausea, vomiting, poor appetite, and joint pain. Jaundice can also occur when chronic hepatitis interferes with the hormonal functions of the liver, which can result in acne.
Hello everybody, I'm Ramya Venkatesha from BSc first year from the Oxford College of Science. Since this week we had World Hepatitis Day, I thought I would share some of my insights on the treatments of hepatitis. So basically there are three different types. First includes the antiviral medication. The antiviral medications may include entecavir, tenofovir, adinofovir, lamivudine and many other such drugs. So these drugs are administered orally and can be taken only with doctor's supervision. Now, what do these drugs do? These drugs can help fight the virus and reduces the damage to our liver. Another more sustainable technique would be interferon injections, or also called as interferon alpha 2b. So this is a man-made version of a substance which is produced to help fight the virus. And it is generally preferred by young people who do not wish to undergo long-term treatment, or by women who wish to get pregnant and after years of therapy. So interferon injections should definitely not be taken during pregnancy, and like any other drugs, injections, these also have a few side effects which include nausea, vomiting and difficulty breathing. Another more severe option is liver transplant. So why this is severe is this treatment is taken only if your liver is severely damaged. What happens here is the surgeon removes your damaged liver and it's replaced by a healthy liver. So the donor can be somebody who is deceased or brain dead depending upon the case. So I'd like to conclude by saying anybody who has a disease or in case fighting for hepatitis B, stay strong and stay safe.